Here is the Chapter 3 information on operating room personnel. Here are the learning objectives for this chapter. Discuss personal preparation for duties as a surgical nurse. Describe the proper attire in the surgical area. Define endogenous and exogenous threats to asepsis. Explain the general guidelines for personal hygiene of veterinary surgical personnel. Describe and perform a proper surgical hand scrub. And explain and perform a surgical hand rub. You should be able to describe the types of surgical hand preparation solutions. Explain and demonstrate the process to aseptically dry the hands and arms after performing a surgical hand scrub or rub. Describe and demonstrate the procedure for donning a surgical gown. Be able to describe and perform an open and closed gloving and assisted gloving techniques. As we go through this chapter, you will probably be aware that there are many and varied duties that technicians can perform in a surgery room. Besides being the anesthetist of record, they can also work as circulators, and they can also be scrubbed-in personnel. It's important to assist the surgeon. If you are scrubbed in by retracting tissue, we need to see what we're doing. Lavage the surgical field with sterile fluid to make sure that tissues stay viable and healthy. And to manage the instrument table so we don't end up with this big mess of instruments, so that when we need an instrument, we might actually be able to think about it, find it. These are some really good things. I like this chapter because this chapter deals a lot with common sense. We don't always see common sense in our profession, so having a chance to actually deal with it is always a real relief to me. As far as nutrition, hygiene, and appearance, you need to eat a meal of substance before surgery. Don't go in on 2 Krispy Kreme donuts and half a cup of coffee and expect to stand there for 4 hours over a long orthopedic procedure. It's not going to go well. Make sure your fingernails are properly groomed. Get those fingernails short. Get the nail polish off. And avoid cologne and perfume. There's nothing better than standing over a surgery table for a long time with somebody that has some cologne or some perfume on that is absolutely obnoxious. And I know you probably love it, think it's great, but some of us get nauseous over that stuff. So, come in clean, but come in odor-free, please. Your book goes into the types of contamination. There is endogenous and there is exogenous. Make sure you know the difference. Proper attire in the surgical area. This is one of my big bugaboos because I get videos and people are doing major procedures, open intra-abdominal procedures, and they have no caps, they have no masks. They are just wearing their plain old stuff, and I'm thinking, if that's my patient, if that was my animal, I'd sue the hound out of you. I wouldn't put up with that, and I don't think you should put up with it either. Number 1. You need freshly laundered scrub suits. Don't go clean cages all morning and see the parvo puppy and treat everything and get crap all over you and then go into surgery. If you're dirty, put on a fresh scrub suit. In fact, if you're going into surgery, you really have to put a fresh scrub suit on regardless. Head covers are required. Your scalp is filthy and you are dripping bacteria, fungi, viruses, alien creatures everywhere as you go about it. Masks, your respiratory system's not a lot cleaner than your head. And finally, shoe covers. Shoe covers are cheap and they keep you from dragging in all kinds of stuff. There's nothing better than being in surgery and having somebody walk through because they got dog crap on their feet. Boy, that's really good. I'd love to have my patient doing that. Follow written and posted dress codes, and if you don't have a dress code, get one. If you're going to do it right. Scrub suits, I'm a big bugaboo on scrub suits. I love scrub suits. Don't wear street clothes into surgery. That includes shoes, jeans, unless you got shoe covers on. Jeans, your old crubby, t-shirt, that kind of stuff. That's what scrubs are for, okay? If it was your animal, would you want somebody walking through right after they've cleaned the parvo puppy? Don't wear scrubs from home into work. Change. These should be freshly laundered in the clinic, not at home, because I don't trust your washing machine. They should fit snug to body, okay? This is not a tent. This is not going to be a 3-ring circus in there. Shirts should be tucked into your pants because I guarantee you, scrub shirts hanging out are #1 source of contamination during surgery. People drag stuff across that dirty front and then they take it to the patient and they wonder where the infection came from. Couldn't be our fault. We were doing everything perfect. And you need a clean lab coat over scrubs if stepping out of the surgery area. Put on a gown, put on a lab coat, do something, but keep yourself clean. You know, I mean, we get into this profession, we supposedly to help animals, yet do we really want to go through life giving them infections because we're lazy and thoughtless? I don't know why we do that. This is what you're supposed to look like, folks. Clean shoes, clean scrubs, scrub top tucked in, tied securely, cap, mask, head covers, gotta have them. Bouffant type head covers, they're not real attractive. I do not look good in them. I freely admit I do not look good in them, but they are the best way to keep that hair in. And that hair, believe it or not, is dripping with bacteria. Masks and shoes, your mask should go over your mouth and your nose. Does no good if you take your mask and you tuck it under your nose. I've seen, I can't breathe. Oh, I can't breathe. You know, I haven't seen anybody die yet. You don't walk through surgical ORs and find people laying on the floor dead because they couldn't breathe through the mask. Of course you can breathe through your mask. It may not be comfortable and it may not be convenient and it may not be what you really want to do, but too bad, okay? Patients come first. Your particular comfort is irrelevant to me. If you're about to sneeze, don't turn head, just step back. Big thing. If you're about to sneeze, don't turn your head, just step back, and as back as far away as you can, okay? Because when you blow that snot and boogers out, it's going to go all everywhere. The further you are away from the surgical field, the less you're going to contaminate. Turning your head really didn't make that much of a difference. Shoes should be comfortable, clean. If you have to, you can use shoe covers, but you really need to have a locker. You need to have a dedicated pair of surgery shoes. If you're going to be working in a practice, that's the best thing to do. If it's a general practice, and I freely admit you don't always have time to do that, throw on some shoe covers. Don't track stuff through the room. Don't contaminate the surgical field. Well, it's way down on the floor. Because it's on the floor, there's no way it can get up to the surgical site. Wrong, it does. Jewelry needs to be removed, okay? I've seen people say, I'm not taking out my diamond earrings. And sure enough, first thing you know, the stud comes off the back and the diamond earring is in the surgical site. Just take them off. Okay, the one exception are little gold balls, and that's okay on your ears. But, you know, no rings, no watches, you know, all that stuff. Fingernails clipped to below the fingertips. If you hold your hand up so that you're facing the palm, if you can see fingernails over the end of the fingers, your fingernails are too long. They need to be cut, and no nail polish. Take it off, okay? Too bad. Hand scrubs and hand rubs. Hand scrub, get that brush out and let's go to town. Remove as many microorganisms as possible from the hands, the nails, and the arms using mechanical and chemical asepsis. In fact, some of the newer studies have shown that, in fact, that actually the scrubbing, the mechanical removal and rinsing does more good than some of the chemical asepsis. We're still going to use good scrubs and rubs, but scrubbing those guys real good really does a wonderful job. There are two types, there are two ways to do this. There's the time method where you do it for a certain period of time, and then there's the stroke method where you count and you do a certain number of strokes. Either way, you need 5 minutes minimum. You can't scrub in less than 5 minutes, and actually 10 is probably a good number to remember. We're going to scrub the fingers, the fingertips, the hands, the arms. Each have 4 sides, and we have to use and get all 4 sides. Antimicrobial scrub agents. There's a bunch of FDA-approved hand scrubs or alcohol-based rubs. There is a brushless technique, which your book talks about. I'm not big on brushless techniques. I still like my brushes. And we need a standardized protocol in scrubbing. Everybody does it the same. Okay, surgeons, technicians, every surgeon does it the same. Everybody does it, whether they agree with it or not, the same way. Okay, otherwise, people are going to do this, they're going to do that, they're going to take shortcuts, and they're going to kind of do it half-ass, and it's going to be a big mess, and there's going to be contaminations, and the first time you break a glove and the hands are clean, you're going to end up with an infection. Scrub solutions, it needs to be FDA compliant, of course, has to have a broad spectrum of activity. They should be fast active and effective, should be non-irritating, You should have persistent effects and cumulative activity. And if there is any doubt at all, read the directions. And then after you read the directions, follow the directions. And your book goes through these in some degree of detail. Chlorhexidine, probably my favorites. Iodophores, those are guys that are pretty good. I've used them. Alcohols, PCMX, brushless rubs. You know, in the end, it's not so much what you use, it's how you use it, and use it properly, and use it professionally, and use it thoroughly. That's what you got to do. Follow the instructions, do it as they tell you you're supposed to, and you're going to have good results, okay, whichever one of these you're using. Everybody needs to use the same. Everybody needs to follow the directions. Everybody needs to do it right. All right, pre-scrubbing guidelines. Remove your rings, watches, jewelry, name tags, pins from top pockets, and so on. You need to go in without stuff on and hanging on you. Just kind of get all that stuff off, because otherwise it's going to be a problem. At some point it will become a source of contamination. Wash your hands and forearms with an antimicrobial scrub and rubbing water. Just wash your hands and arms real good to start with, okay? Get the big chunks off. Clean the subungual areas using a disposable, the area under your fingernails, using a disposable clean pick. Okay, if your fingernails are short enough, probably you can skip that. Mine are back to about the level of my second knuckle, and so I don't worry about that much. But a lot of people have, they need to clean them out, make sure it's clean. Keep hands above elbows to allow water to run off. This is one place that people end up having to redo their videos. They forget. Hands are always above the elbow. From start to finish, period. Your hands are above your elbows. Water runs from your hands down to your arms, not from your elbows down to your hands. First time that happens, that task fails. And then don't touch anything. Okay, you're starting to get clean. Don't touch anything. Okay? Except the things you're supposed to be touching to get scrubbed. Apply your antimicrobial agent to the wet hands and the forearms. Get it on there real good. Don't pick up the bottle and squirt it. You either need a foot pump or for somebody to apply it for you. Don't touch anything. Have it applied. Then brush each fingertip 10 times. Make sure you go under the fingernails. Then do the sides of the fingers, beginning with the lateral side of each. Okay, can I actually start medial? Yes, you can start medial. I don't care. But you do it the same way every time. Get the web between the fingers. Get the lateral side of the hand. Get the palm. Get the outside of the thumb. Base of the fingers to the wrist. Elbows, forearms to elbow. And then your wrist. Do every side. Okay? Do the fronts, the sides, the laterals, the medials, the palmar, the plantar, everything. Good picture. Scrub, 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 scrub. And then scrub some more. More scrubbing. Doing the lateral side. Doing the palm. Do your strokes. Do your time. Again, it's not a matter of which technique is better. It's doing the technique properly, and you'll be successful. More scrubbing. Here we're doing the lateral side of that thumb. Get the back of that hand. Get in the forearms. We're going to do the forearms 4 sides, 4 times. Some people will scrub hand, arm, drop, do again. Some people will do hand, drop, brush, arm, then repeat. There are so many techniques to do it. If your technique is correct, and most of them are, just do it consistently and you'll be all right. And then finally on the right, rinse from the hand down the arm, not from the arm down the hand. Do not allow water to dribble back down to your hand because it's dirty up there and you're just recontaminating. The rub agents seem to work real well. Fingers, hands, forearms, elbows, starting with the area you need to be the cleanest, which are going to be your hands because that's going to be what's in the surgical area, to the area that doesn't have to be the cleanest, which is going to be the elbows. Use the amount of hand rub recommended by the manufacturer. If all else fails, read the directions and follow them. Amazing the things that can occur. After hand scrubbing or rubbing, dry with a sterile towel. And we'll show you this is properly laid out. We have a table The surgical person is scrubbed. They are set. They are opening the inside of a properly opened pack, and then they are going to dry their hands and arms. There are several techniques. There's a four-corner technique. There's a top-bottom technique. In most cases, what we do is we dry hand, hand, arm, arm, switching sides of the towel so that we have each towel has 4 clean sides. Each side is corresponding to a hand, an arm, and an arm. So we're not drying a hand and then an arm and then going back from the arm part of the towel to the other hand, because that's going to pick up contamination. Gown, usually our gown and our towel are going to be in the same pack, so we dry our hands, drop the towel. That's why God invented gravity. Gravity is a wonderful thing. If you drop things, it will fall to the floor. I know people that don't believe in gravity, but it always seems to come back and prove itself as a viable physical principle. Drop things. It goes on the floor. That's the end of the towel. Then we're going to pick up the towel or the gown. We don't drop the gown. We put the gown on. Gravity gowns don't go along. And we're going to properly apply it, showing we're pulling it off, moving it away from the table so we don't hit things, we don't touch things, and it's going to, at this point, be ready to be opened up and gowned on. Don. We're going to don the gown. Gowns, as you probably know, should be done inside out, so we're going to pull it open, touching only the inside of the gown. We don't touch the outside of the gown because the outside of the gown has to stay sterile, and while your hands are clean, they are not aseptic. The only way for your hands to be aseptic and for you to be able to touch the outside of the gown is if you have autoclaved them. If you'd like to autoclave your hands, then you can touch the outside of the gown. Otherwise, you do not do that. Good illustration from your book showing this personnel putting on the gown. Hands are in the inside going into the sleeves. At no point have we touched the side of the gown that's going to be facing the patient. Once you are gowned and tied in properly, then you're going to need to glove. And there are 3 methods for gloving. There is the closed, the open, and the assisted. In almost all cases, closed gloving is going to be the preferred technique. With closed gloving, there is no bare skin is exposed. Your hands are kept inside the gown. If there's any questions about how to do that, I have a good video on your site that will show you how to do this. You do palm to palm, thumb to thumb, fingers of the glove facing the elbow, just like in the picture or following how we do it in the video. Following the technique, we're going to flip that glove over onto the sleeve. There you go, flipped it over. Now we're going to be able to put our hand in. Notice no hands are exposed, no fingers are seen. Nothing outside the inside of the gown is touched. The cuff of the glove completely covers the cuff of the gown. See? All set. Once we get our hand down in there, finger in every hole and a hole for every finger, then we're going to take the other hand, the gloved hand, we're going to flip the next glove onto the cuff of the gown without the left hand, in this case, being exposed. Just like the other one, place it down, get ready to slip it over. Pull it into place, push the hand down into the glove. There's a hole for every finger and a finger in every hole. We try to avoid having more than one finger inside each finger of the glove. Open gloving is often done when one glove becomes contaminated or when no gown is needed, such as for minor surgical procedures, bone marrow biopsies, catheterizations, when you're just putting on sterile gloves and you don't have to worry about having a gown. When you have a gown, you need to use a closed gloving. When you're just putting on gloves for something simple and quick, for example, doing anal glands, though why we would use sterile gloves for anal glands, I don't know, then we're going to use open gloving. And in this case, only the folded cuff of the first glove can be touched. We're touching the right glove with the left hand, and we're touching the inside because the inside is going to go to the arm and the hand. We don't touch the outside. And then we pull it on and pull it down. In this case, we're going to reach with the right hand into the inside of the cuff. So we're touching sterile outside of glove to sterile outside of glove, and we're not going to run the risk of contamination. Stick the left hand into the left glove, making sure we are holding it properly. In fact, in this picture, that right hand thumb really should be inside the cuff, not touching where it's touching. Bad picture. And we pull down, and that way it's all on where it's supposed to be. We make sure we only touch inside of glove with inside of glove, outside of glove with outside of glove. And then we can come back and pull our cuffs down so that everything is where it needs to be. Assisted gloving is the third type of gloving after open and closed. In this case, it's usually done in surgery with scrub personnel. It's when a sterile team member needs or helps another scrubbed member glove. The cuff of the gown should not be pulled over the hand. In this case, you just put your gown on, you walk in, somebody's got that glove open for you, and you just slide your hand in. This is what a lot of human surgeons do. They scrub the gown, then they walk into the OR, then somebody's standing there with their gloves ready to put them on for them. If we should experience a contaminated gown during surgery, something happens, somebody decides they love you, so they go up and give you a big hug and they make dirty your front. What will happen is the circulating nurse will unfasten it and pull it off from the inside out from the team member who was contaminated. So the non-sterile person is going to untie it and is then going to remove the gown from you. The contaminated person removes their gloves and pulls them off inside out, and sterile sleeves can be used to help facilitate the process. Wrap up with, on this part, a couple of things you need to know. Avoid locking your knees when standing for long periods of time. It really does hurt them, and your feet's going to start to hurt, your joints are going to start to hurt, you just don't do well. Make sure that you're well nourished before you go in. If you have 2 Krispy Kremes and a Coke for breakfast, you're going to poop out pretty quick. You need a good breakfast, lots of protein, and when you have a chance, slowly shift weight from your leg to leg, keep some circulation going. A lot of ORs are using cushion mats now, things to help relieve stress on joints, help improve circulation, anything you can do to keep your legs going and that kind of stuff. From the waist up to your chin, you're going to have to be really cognizant of sterility. Don't touch, don't break, don't get into trouble. Okay? And that's going to be a lot of what you need to do to be an effective, a competent, a caring, and an aware surgical assistant.